Hello and welcome to Health and Social Care. This is a video just intended to introduce you to the course, to give you a little bit of a heads up about what you should be expecting when you start the course and how to best prepare. What I'm going to do now is I'm going to hopefully share my screen with you so that you can see what I'm seeing and we can walk through the course together. Okay, so first of all, welcome to Health and Social Care. What is health and social care? So this is quite often a completely new term to many of our students. When we're talking about health and social care, quite often we are talking about health, so therefore we are looking at medicine, we are looking at nursing, we are looking at support work. But also when we're talking about social care, we are talking about looking after people in general. So actually, the kind of careers which health and social care can take you onto are really, really vast and wonderful, but generally always person-centered. So let's just take a look at the background here. Some of the kind of examples of where some of our alumni are. Alumni are people that have students which have left Taverham High School. So let's just take a look. Loads and loads of our students come onto the course to for health and social care wanting to be a midwife. Sometimes during the course they find out a little bit more about that career and it changes their direction. But many of our students do end up becoming midwives and do come and visit us in school also. We've got a couple of our alumni which have found careers in adult nursing, adult residential care, and support work in that area. One of our students 2 years ago is going to be coming back this year to tell us about her experiences at university. Really exciting stuff. We've also got, like, for instance, police work. Quite often health and social care and the structure of the course is effectively the foundation for police work. So it's really, really well entwined with that career. And just another example is quite often people take this course when they're wanting to go into routes for coming into teaching. I took a health and social care course and that helped me and supported me on my career path, but many people just use it as a stepping stone to get either towards their health career or a social care career. Okay, so let's move forward and see what else what this course has to offer. Okay, so effectively during the course you will be studying 6 units. 1 to 4 are absolutely mandatory, so they must be taught, and 10 and 13 are a choice. So we actually choose that at Taverham High School because we think it really supports you on your next steps. Taking a look, Unit 1 at building positive relationships. Unit 2, equality, diversity and rights. Unit 3, health, safety and security. And Unit 4, Anatomy, Physiology for Health and Social Care. Unit 10, Nutrition for Health. And Unit 13, Reproduction and Early Development Stages. Now, this is how those 6 units are split into 2. So we've got half of your course, 50% of it, is based on portfolio work. In old money, that'd be called coursework, which means that you have to write or create a project in a set amount of time, which can be submitted as your final piece. The exam work, units 2, 3 and 4, are all examined in, for instance, the gymnasium under exam conditions. So that will be what you're used to. But the portfolio work, you have a lot more time to process and analyse what you are saying, generally around 10 hours per assessed piece. So effectively, you're looking at 2 very different styles of learning that can actually support all our different learners at Taverham High School. Okay, so let's break this course down into what it actually means. Okay, so let's go for that first one, methods of communication. That's really quite linked with psychology and really heavily looking at you as an individual student, but actually we're really projecting you into your career. And actually, if you can be a reflective practitioner, how is the method that you are communicating being effective to your audience? Okay, Unit 2, this is an examined unit. This one's really looking at equality, diversity and rights. So it's looking at the legislation which has been passed by our society, by our government, to best support people in health and social care settings. Unit 3 is another exam unit, health and safety and security. Again, it's looking quite a lot at legislation, policies and procedures. Unit 4, I really love teaching this unit. It's basically a version of A-level biology. You learn about all the systems of the body, for instance, the digestive system, or for instance, your musculoskeletal, where you're looking at your bones and your muscles, and you find out how it works. But unfortunately, it doesn't work well for everyone. So actually, quite often we look into details about the malfunctions, how it can go wrong. For instance, we need to understand the causes of osteoporosis or osteoarthritis. We need to learn about the treatments for that, about how we diagnose it, and actually to really understand our patients and how it affects their daily life. Then we can start putting the right treatment and right care packages together for them. That's really heavily linked to nursing, that particular unit. This one here, Unit 10, Nutrition, I love teaching this one as well. This one's basically training you to become a dietitian, and that's really important in many different careers, not only just for your career, but also for yourself. To understand about dietary guidelines is a crucial skill for life. So effectively with that one, you take a look at different diets and you analyse them. And the last one, Unit 13, Sexual Reproduction and Child Development. So this one is looking just specifically at the first year of life of a child, so really getting to know those children's development really well, but also the stages of reproduction and issues which can come along with it in greater detail for this Level 3 course. So in summary, what's this whole course about? In summary, I would say it's just this box here. It's learning about your own body. It's learning about the health service, which we're so proud of in this country, and specifically looking at rights and methods of communication within our health and social care services. And it really actually improves our own understanding of communication through that process. A couple of examples of those units and what we go into. For instance, this picture here is representing the nutrition element. One of the tasks that you have to do for that coursework is you have to take someone's weekly diet plan and you have to analyse it. So you have to then evaluate what's the good bits about it, what's the bad bits about it. Then you have to assess, with those bad bits, what kind of medical malfunctions could that lead to? For instance, could it lead to rickets if they're not getting enough calcium in their diet? It's really interesting. It helps us be reflective about what we eat. Communication for Unit 1, we actually, for part of your coursework, we ask you to film each other doing a role play, quite often trying to coax a patient who is going through some kind of trauma back into the place where you need them to be safe and secure within their environment. That's a really exciting. There's a lot of giggles when we get through that one. We've got over to this one here, looking at Unit 13, we're looking at reproduction. And really interestingly, we start to look at the disabilities which occur in utero. That means when babies are still growing in the womb, we really look into the possibilities that those babies could be have malformations. For example, Down syndrome. And we look at what causes that and how to best support the parent if that occurrence does happen with a patient in our care. We look at all different types of legislation. Some of them, for example, the Sexual Offences Act of 2010, we take a look at that in closer detail. We look at the Disabilities Act of 2010 also, NHS and Community Care Act, and you get to know about legislation and really up your almost your jurisdiction understanding there. The one in the centre is all talking about the cardiovascular system, about Unit 4. With that one, you learn about the causes of cardiovascular disease. What causes angina? How does it affect our individuals in our care? Overall, a thoroughly enjoyable course. How do we plan it out? In Year 12, we start with Unit 2, which is an exam unit. We then go on to a coursework unit, which is Unit 1, Building Positive Relationships. And we also include the whole of Unit 4, which is Anatomy and Physiology. Absolutely love teaching that. That leaves the other 3 for for year 13. So we do 2 pieces of course, 2 pieces of coursework, unit 10 and unit 13, and we have an exam. So actually in the first year, in year 12, you actually get rid of 2 exams. So actually that takes a lot of pressure off for your year 13 by taking this course. Okay, so how do you better prepare for starting your course in September? Well, there are 2 textbooks that are currently out. There's one which is an actual textbook, which is has the majority of our course within it, which is fantastic. That's £26.99. You can get that from Hodder Education, but you can get it off Amazon or any other sellers, retailers as well. We also have the revision guide, really useful for more concise notes. So they're much shorter, it's a smaller book, but that's for £9.99, and you can get that from Hodder Education or any other retailer as well. So how do you better prepare for September without buying the books? So other equipment that you might need, and lever arch file for organising all of your notes, pens and highlighters, and plenty of lined or hole punched paper. Now you'll be given a transition booklet that in it will give you another summary of your course, but also it will have in there some activities which is really important for you to complete over summer so that you can hand that in on the first lesson back in September. Those different tasks which have been set for you, we will use them later on in the course. So we're effectively setting you a bit of the course early. Okay, so as far as we are concerned, that is your summary of what's to come with health and social care. I absolutely love teaching the course and can't wait for you guys to join us. So take care. If you have any questions, please don't hesitate to contact me on through the contact details which are attached. Thanks very much.